Hello, my name is Nathan Kanter. I am currently a double major in data visualization and web programming and design. I am a member of the Bird Viz laboratory, and my research mentor is Dr. Vetria Bird. So my research using information visualization techniques to uncover patterns in pubescent lupus data is about taking data provided by Riley's Children's Hospital, which they collected over a 10-year longitudinal study on 69 adolescents with systematic lupus erythematosus, also known as SLE or lupus. Lupus is a chronic autoimmune disease that can affect anyone, and anyone can technically get it, but it is disproportionate as 90% of people with the condition are female. In addition to that, if you are of African or African American descent, the disease is proven to be more fatal. And if you are of that descent, Asian descent or Hispanic descent, you are more likely to receive the condition. It is unknown where the disease comes from. Research shows that it may be a genetic link, but that is not 100% confirmed. And the goal of this study is to try and see if there is any connection between the severity of the condition and where a adolescent is through puberty. So I decided to do this by creating an interactive dashboard in Tableau using a subset of the database that Riley Children's Hospital provided. It is a subset because the full data set has yet to be approved for research purposes. So as seen in figure 1 in the top right hand corner of the poster is my final results. The first chart I made was the number of symptoms by race. The reason for this is because it is shown to be disproportionate in terms of what races can get the condition. It is also worth taking a look to see if maybe the amount of symptoms are different as well. However, taking a look at the chart, each color is a different race, and the larger the box is, the more symptoms they have. However, most of these people have around the same amount of symptoms, so it seems pretty evenly spread. Now, that doesn't show the severity, but it does show the specific symptoms, which there are a wide array of. As for comparing the severity of the condition to where they are in puberty, there are the two charts below that in figure 1, which is the SLEDAI score by visit and leptin count by visit. The way you read that chart is the further right the dot is, the later the visit was. Each visit was approximately conducted every 3 months, where the assorted hospitals over North America would collect an assortment of measurements, both related to and not related to the condition, such as height, weight, hormones, and the like. So SLEDAI score is a score used to measure the severity of SLE. The higher the score, the more severe. And leptin count is a measurement of the hormone leptin, which generally increases when someone is going through puberty. So the way the chart is for both of them, the redder it is, the higher their scores are for both the leptin count and the SLEDAI, and the greener it is, the lower. Now, the unfortunate news is there does not appear to be any clear connection. All the patients seem to have either sporadic data points or fairly consistent ones for both the SLEDAI or the leptin. However, using the section on the right in figure 1 to filter, maybe the races show it differently. Well, in figure 2, it is filtered by African Americans. And one would think there is a connection. Taking a look at patient CIO4 in figure 2, it appears to be a high SLEDAI count and then a consistent drop. And the leptin count shows the same. It is high and then it drops, but then it's also a little sporadic. However, that's not the case for others. If you look at patient DAO2, their SLEDAI score is pretty consistent, but their leptin count goes up and down. So it doesn't seem that there's any clear connection between the two. Moving forward, I would hopefully, once receiving the entirety of the database, create a node link diagram using the software Cytoscape to take a look at many different variables, including something known as the Tanner score, which measures where someone is in puberty, and the score never decreases once it goes up. and hopefully that should show more results, as we'll be able to see everything at once. Thank you.